Escitalopram belongs to a class of drugs known as selective serotonin reuptake inhibitors, or SRIs. This class of drugs is primarily used to treat mood disorders, anxiety disorders, and certain mental health conditions. SSRIs work by increasing the levels of serotonin in the brain, which plays a key role in regulating mood, emotions, and anxiety. Escitalopram is the S enantiomer of citalopram, meaning it's a refined version that is designed to be more selective and effective in its action compared to its parent compound. Approved by the FDA in 2002, escitalopram has since become one of the most commonly prescribed antidepressants worldwide. Let's define indication. In medicine, an indication refers to a medical condition for which a drug is approved or commonly used to treat. For escitalopram, there are two primary FDA-approved indications. 1. Major depressive disorder, MDD. Escitalopram is approved for the treatment of major depressive disorder in both adults and adolescents aged 12 and older. MDD is characterized by persistent sadness, loss of interest in activities, changes in weight or appetite, difficulty sleeping, and feelings of worthlessness or guilt. Studies have shown that escitalopram can be highly effective in alleviating these symptoms by restoring the balance of serotonin in the brain. In many clinical trials, it has shown faster onset and higher remission rates compared to other SRIs, making it a popular choice for treating depression.
Generalized anxiety disorder, GAD. Another FDA-approved indication for escitalopram is generalized anxiety disorder, GAD. This condition is characterized by excessive, uncontrollable worry about everyday things such as health, finances, or work. It's accompanied by physical symptoms like muscle tension, irritability, and sleep disturbances. By increasing serotonin levels, escitalopram helps reduce anxiety, improve mood, and enhance overall quality of life. Clinical studies support its use as a first-line treatment for GAD, especially in patients who may also have co-occurring depression. Beyond its FDA-approved uses, escitalopram is also prescribed for various off-label indications. While these uses haven't been officially approved by regulatory agencies, clinical evidence and practice suggests that escitalopram can still be effective. Obsessive-compulsive disorder, though not FDA-approved for OCD, escitalopram is sometimes used to treat this condition, which involves repetitive thoughts, obsessions, and behaviors compulsions. SSRIs like escitalopram can help reduce the frequency and intensity of these symptoms. Panic disorder, people experience sudden, intense episodes of fear, panic attacks. It can feel overwhelming and debilitating. Escitalopram, when used off-label, can reduce the frequency and severity of these attacks by regulating serotonin levels. Post-traumatic stress disorder, PTSD is a mental health condition triggered by traumatic events. It's often treated with SRIs, and escitalopram has shown potential in managing PTSD symptoms like hypervigilance, intrusive thoughts, and mood swings. 4. Social anxiety disorder, social phobia. Though officially approved for GAD, escitalopram is also prescribed off-label for social anxiety disorder, where individuals experience extreme fear of being judged, embarrassed, or humiliated in social settings. How escitalopram works. Its mechanism of action revolves around serotonin, a neurotransmitter crucial for regulating mood, sleep, appetite, and emotional well-being. Serotonin levels are often too low in people with depression or anxiety. In the brain, serotonin is released into the synaptic cleft, the space between neurons. Normally, after it has acted on the receptors, a transporter protein takes serotonin back up into the presynaptic neuron. Escitalopram blocks the serotonin transporter, SERT, preventing the reuptake of serotonin back into the neuron. Escitalopram is available in tablet and liquid forms. The dosage varies depending on the condition being treated, the patient's age, and how well the patient responds to the medication. Below are some general dosing guidelines. For major depressive disorder, MDD, starting dose, 10 mg once daily. Maintenance dose. The dose can be increased to 20 mg daily after 1 week if needed. Maximum dose, 20 mg per day. For generalized anxiety disorder, GAD, starting dose, 10 mg once daily. Maintenance dose can be increased to 20 mg after 1 week. Maximum dose, 20 mg per day. Like all medications, escitalopram comes with a risk of side effects. While many people tolerate it well, it's essential to be aware of potential reactions. Common side effects: nausea, headache, dry mouth, sweating, insomnia or drowsiness, fatigue, decreased sexual desire or performance. Serious side effects require immediate medical attention. Serotonin syndrome, a potentially life-threatening condition when too much serotonin accumulates in the brain. Symptoms include high fever, agitation, confusion, rapid heart rate, and muscle rigidity. Suicidal thoughts, especially in young adults, adolescents, and children. Escitalopram can sometimes increase the risk of suicidal ideation. Patients should be closely monitored, particularly during the first few weeks of treatment. QT prolongation. Escitalopram may cause an abnormal heart rhythm, particularly at higher doses, so it should be used cautiously in patients with existing heart conditions.